Let me introduce to you our first speaker for today. Our first speaker needs no introduction. Professor Dr. Tan Mopin is a prominent senior consultant geriatrician at UMMC, and she's also the president of the Malaysian Society of Geriatric Medicine. Professor Tan founded Act for Health. She's also the deputy director for the Center for Innovations in Medical Engineering, UM, also the medical director for Genting Dementia Daycare Center and Managed Care Sendirian Berhad, and she is currently the principal investigator of the Transforming Cognitive Frailty into Later Life Self-Sufficiency program. So, I won't keep you long. Prof. Tan, on to you.
Thanks for the opportunity, and those who know me will know I'll never turn down an opportunity at sharing information about falls prevention for older people, because that is really my pet subject. So falls, okay, so we all know what falls is, right? We all in Bahasa Malaysia is jatuh, in Chinese is 跌倒. I'm Hokkien, so my grandma and my great aunt always says "pato pato." So we all know what falls are, okay, and actually, if we think about how falls do happen, it's really because for us to stay on our 2 feet, it's actually quite a remarkable feat. Because imagine that we are actually balancing on a pair of chopsticks. So our whole body, our head, our torso, and our arms are balancing on just 2 sticks. And in order for that to happen, it calls for amazing balance, and also strength, and also the ability to sense where we are in time and space. And that is really an amazing feat. And unfortunately, because this is such a hard thing to do, in fact, till today, no human being can actually replicate walking or standing using a robot very well. So we don't actually still have a humanoid robot, because being upright is simply the hardest thing to do in the universe. So why does the older person fall? Well, if anything is wrong with this mechanism that allows us to balance on our 2 chopsticks, is actually going to affect the ability for us to remain upright. So what could go wrong? Well, usually when we think about falling, we always think about something wrong with the brain. And often, the minute you fall, you're taken to the hospital, and they do a head scan straight away. Why? Because they're looking for a stroke. But thankfully, most of the time, after just because you've fallen doesn't mean you've had a stroke. In fact, it's quite unlikely for a stroke to have happened at the time that you have fallen. But what tends to happen is if you have had a previous stroke, then your risk of actually falling increases. So it's people who have had a stroke in the past. So you would have known about the stroke because you would have had a problem with weakness down one side of your body, problem with your speech, problem with vision or sensation down one side of the body, and then you would have been diagnosed with a stroke. But having that stroke would have increased your risk of falling after that. And unfortunately, because our population is growing older, and older people have an increased risk of developing dementia, those people with dementia are more likely to fall. Having dementia, because you have issues with computational ability of your brain, then that leads to increased risk of falls in our older persons. And everybody knows about Parkinson's disease. Now, Parkinson's disease is much less common than dementia or stroke, but people with Parkinson's disease become very stiff and they walk in a shuffling way. So having Parkinson's disease really increases your risk of falling. So people with Parkinson's falls a lot. And therefore, I have an overrepresentation of people living with Parkinson's disease coming to my clinic. But most of the time, the thing that is wrong with your brain that leads to you falling is because blood is not getting to your brain. So we call it low blood flow or low brain blood flow. And that happens because of low blood pressure, usually, or sometimes it's due to a problem with the heart not pumping enough for the brain to blood to get into the brain. I'll come to that in a short while. Okay. And the other thing that often happens as you get older is you need glasses to read, correct your eyesight. You might have a cataract or glaucoma, or sometimes this is less curable, a problem with the back of your eye, the retina, and that problem is called the macular degeneration. But any problems that affect your vision, most of it can be corrected or prevented if you have regular screening of your vision. But any problems with your vision could actually increase your risk of falls. And that includes glasses that don't work properly. So sometimes you could, when you've had glasses made, they overcorrect for your eyesight. So and that could actually increase the risk of falls. Or if you choose to wear bifocal lenses, then what happens is when you look down, you're actually looking through the reading part of your glasses. So if you haven't learned how to adapt, then you can't actually judge the depth of stairs, and that increases your risks of falls. So problems with your vision as well as inappropriate glasses. Okay, how about hearing? Now, people rarely think that hearing is actually actually leads to increased risk of falls. And in fact, it came as a surprise to me too when we did our research. For some reason, my student put hearing in as a risk factor, and when she ran the tests, hearing came up as a positive risk factor. So I was like, oh, I've never heard of that. And then after that, a lot of other people started replicating the same thing. Now, we don't really fully understand why hearing leads to problems with falls, but let me propose this to you. So our ears doesn't only do hearing, it also does balance. So the balance mechanism is a 3 semicircular canals, and then it's linked to this thing called a cochlea. That's the part that controls the hearing, the snail-like bit, and then the snail-like bit here, and then the part that controls the balance is a semicircular canal here. That's our middle ear. And any problems that is linked to the hearing bit of the ear could also cause a problem with the balance. And therefore, having hearing problems increases your risk of balance problems, and therefore you are more likely to fall. Okay. Now, I mentioned low blood pressure or low brain blood flow, and that does not come from a problem from the brain. It comes from a problem for blood flow delivery to the heart. And in order for blood to the brain, in order for blood to flow to the brain, we need our heart to pump. And we need a high enough blood pressure for it to go up. I'm sure all of you know about the showers. You know, if the water pressure is low, then our shower upstairs doesn't work. It's the same situation as brain blood flow. So what happens, what can happen to our heart is that sometimes because the weather is too hot like it is now, there's a heat wave and we haven't drunk enough water, then we are dehydrated, our blood pressure is low, so our heart can't pump blood hard enough for it to go up to the brain. But sometimes the blood pressure is low because of medications we have taken or because of an illness. But being very sick, such as having a bacterial infection or a heart attack, can cause low blood pressure. The other thing that happens rarely, but this is potentially life-threatening, is that the heart wiring goes wrong. So our heart actually works on electricity. So there's a pacemaker in our heart that tells it to pump about 70 beats per minute. But if that pacemaker is not giving the signal at the right time, then a heart might pump too slow or too fast, and then when it does that, it doesn't pump enough blood up to our brain, and that increases the risk of falls. And we all know about muscle weakness. And in fact, sometimes we overdo it because everyone assumes that people fall just because their muscles are weak. Yes, muscle weakness is associated with at least 2 out of 3 falls. So if your muscles weren't weak 2 out of 3 times, you wouldn't have fallen. But and therefore it's very important to actually increase our muscle strength to reduce our risk of falls. But it is not the one and only cause of a fall. Okay, so the other thing that people rarely think of is actually having problems with your bladder. Okay, so a lot of times, as you get older, especially for us women who have had children, our pelvic floor gets weaker. So so people tend to may leak when they cough, or sometimes the other way around, they might feel the urgency, and when they need to go, they need to go. And this urgency actually makes them rush to the toilet, and therefore they're more likely to fall. But even for people with the stress incontinence, so those people who leak when they cough, they tend to avoid drinking water with the preconception that if we don't drink so much water, we won't eat so much, because no in, no out. But that will cause them to be dehydrated, more likely to have low blood pressure, and then they will fall. Yeah, I do hear a bit of interruption in the back. Everyone please make sure that you've muted your line? Great, thank you. Okay, so we're down to the joints now, and we do know that people, as you get older, you're more likely to have arthritis. And arthritis, the risk factors for arthritis includes overweight, but also being a housewife, and some occupations might increase the wear and tear on your joints and increase your risk of arthritis. So having arthritis will reduce the balance, and therefore it could also increase your risk of falling. Okay, but one of the most common cause of falls, in fact, in our research, we found that 4 out of 5 people who fall have this risk factor. That is, taking too many medications. And this is one of the things now that happens. As people get older, they tend to collect medications. So now people with blood pressure, with taking too many medications, might have an increased risk of falls. And this accounts for 4 out of 5 of people who have had a fall. Unfortunately, as you get older, you are more likely to take more medications. And you might start off in your 40s taking a blood pressure medications, and then you take 1 tablet, 2 tablets, 3 tablets maybe to lower your blood pressure and keep it right. And then you test your cholesterol, it's a bit high, you take cholesterol medication, and then after a while, you also end up taking an aspirin because your doctor says, your risk of heart disease is high, maybe take an aspirin for prevention. And then you develop diabetes, you take diabetes medications. You develop arthritis, you take painkillers. Eventually, you start collecting medications, and all medications, as you know, has side effects. I'm not saying stop all your medications now, because you might need it. But what happens is, if you take a lot of medications, the medications might interact, and then it might lead to an increased risk of getting side effects. So common side effects we see from medications include drowsiness. So this happens mainly with painkillers, and also medications we take for insomnia. So sleeping pills, psychiatric medications, and they might also, those drugs that cause drowsiness might also lead to confusion. They might lead to blurred vision, dry mouth, and then of course medications that lower blood pressure. If you take too much of it, then it might actually end up lowering your blood pressure, giving you low blood pressure. And sometimes they have side effects of lowering your heart rate as well. Most medications also cause problems with nausea and vomiting, problems with your appetite, too much or too little. And things like aspirin can cause gastric ulcer. And a lot of medications also give you constipation. And sometimes it can lead to problem with your bladder. And a lot of medications also cause muscle weakness. The list is very long, but these are the most common side effects that increase the risk of falls in the medications that we take. Please don't stop taking your medications today. You need them if your doctor has prescribed them. But what we are asking is that please go back and see your doctor regularly and remind them to review your medications. And what we're trying to do is to work with pharmacists and doctors to ensure that medications are regularly reviewed, and those that are not needed are actually stopped and if we detect side effects that is linked to a medication and you still need a drug to control that medical problem, then we might have to swap the drug. So don't do it without medical advice, but please be aware that if you take too many medications, you're more likely to fall. Now, there's another thing that people tend to do is they go and see this doctor, they take one medication. Then they go to see another doctor, the doctor gives them medication. They also take that doctor's medication. But what they do is they don't tell the second doctor what the medication the first doctor take. Now, you can't do that. The doctors that you see need to know all the medications that you're taking, and also the supplements. You shouldn't mix. Okay. So the next thing that increases the risk of falls is our environment. And this house does not really gives me much confidence in helping an older adult stay on their feet. So everywhere is extremely cluttered. There's loose sheets of paper on the floor. And if this person loses balance and tries to catch balance of any of the objects in that room, the object will fall with him or her. So unfortunately, hoarding is a very common behavior amongst Malaysians, and particularly in some older adults. It's not so bad anymore, but it still happens, especially when our older adults have been through the war. And they've been through bad times, hard, scarce times. So there's a tendency to save everything. Don't throw anything away. So the house becomes very cluttered. There's no clear walkway. There are things lying around in the floor that can slip you or trip you up. And that increases your risk of falls. Okay, and then how about shoes? Yeah, I know us girls are very vain. We like high heel shoes, make our bottom stick out a bit and make us look taller than we are. And we feel that makes us look more attractive. But unfortunately, not having the right footwear will also increase your risk of falls, because the reason why our feet are the way they are is to actually maximize our balance. And so anything that alters our center of gravity will actually potentially tip us over. Okay, so these are the 3 most common reasons why older Malaysians fall, according to our research study. Medications, so that people take. So 4 out of 5 people who fall have taken too many medications. Unsteadiness. 2 out of 3 of them will have problems with muscle weakness or balance problems that will make them unsteady and more likely to fall. And low blood pressure, that also affects 2 out of 3 of people who have had a fall. And the blood pressure can be low from medications, but also from conditions such as diabetes, Parkinson's disease, dehydration, bleeding, and also diseases that affect the nerves that controls our blood pressure. We call it autonomic dysfunction. Then you'll say to me, hey, hang on a minute, 80% plus 66% plus 66%, your math, something wrong with your math. It's added up to like 200%. You're right. It's because older people tend to have more than one risk factor for falling. So we call it multifactorial. So just because you're taking too many medications doesn't mean that that's the only risk factor. You might have a combination of medications issues and also visual issues. And if you only had one of those risk factors, your risk of falling is far less than if you had 2 or more risk factors. So we call this multifactorial. And hence, when we try and reduce the risk of falls, we call this secondary prevention. We actually need to screen for more than one risk factor and correct as many of them as possible without inconveniencing the older person, or at the rate that the older person can accept. Okay, so as I mentioned, people tend to have multiple risk factors, and the multiple risk factors will actually amplify the risks of falls. Okay, so how common are falls? 1 in 6 our older Malaysians fall at least once a year. And these are quite old statistics now. It was published by the National Health and Mobility Survey in 2018. And we haven't had a chance to repeat that. We hope that the government will actually fund another national survey soon, because it's been like 6 years. Okay, So what happens is after we fall, after a fall has happened? Okay, what we are most worried about after a fall is a fracture. Fortunately, most people who fall don't fracture, but still we're talking about a large percentage, it's about 10-15% of falls do result in a fracture. And usually there's a warning sign before the worst fracture happens. So fractures happen after a fall, mainly because the bones are not as strong as they can be. And we call this condition osteoporosis. So what often happens if the older person falls is they will put their hands, loses balance, they'll put their hands out to save themselves. So they will fall on an outstretched arm. And that will lead to a wrist fracture. And wrist fractures are usually quite easy to treat. They don't need admission. Sometimes you might need an operation, but usually just a plaster cast and they will fix themselves. But after that, what people must do after a wrist fracture is to go and do a screening test for osteoporosis. If there's any delay in getting the test done, we know that the waiting list can be quite long, and depending on where you live, access to a osteoporosis scan is actually may not be that good. You should start treatment first until you can get the scan. And the other thing that happens, especially if you ignore a wrist fracture, when next time you fall, your reaction might not be so good, and you don't put your hand out to save yourself. Then if you fall sitting down, you might actually end up getting a vertebral fracture. So this is an X-ray side on. So if you're standing we're looking at you from your side, we take an X-ray. So this person is looking to my left. I think it's your left too. And then you can see 1, 2, 3. This vertebral bone is actually squished. It's called wedge-shaped. So that's an osteoporotic vertebral fracture. And if we don't do anything about that one, what happens next is the one that we fear most, a hip fracture. So what happens is this person has lost their reflexes, and when they fall really hard onto the side of their hip. And then what happens is that there's a crack on the hip joint, on the neck of the hip bone, because that's the weakest part. And that takes a major operation to mend it. And the outcome of the operation may not be so good. And we have to put a lot of effort in to rehabilitate someone after the operation, but some don't actually survive this fracture. So we do as much as we can to prevent falls and treat osteoporosis to avoid this very fracture. And this can happen in roughly 2 or 3% of falls, particularly in people over the age of 80. So this is what we fear most when older people fall, and that leads to a ridiculous number of brain scans that are being done in an accident and emergency now. That is a bleed to the brain. We call it the subdural hematoma. So if you looked on the right side of your screen over here, there's this blood clot on the right side of the brain that is pushing the brain a little bit on the side. Because what happens is as you get older, your brain might experience some shrinkage. So there's a bit more space inside the skull. So when the older person falls, there's shaking of the brain, and it tears the thin-walled veins outside the lining of the lung, of the brain, within the skull. So then, because there's a limited space inside the skull, this can cause pressure into the brain. And if the bleeding doesn't stop, then this person might actually have the brain pushed out of the hole in the skull, and this leads to death. But fortunately, for most people, even if they do have a bleed to the brain, it can be treated without surgery, just a little bit of observation. The blood actually will actually resolve itself. But in a small number of people who have had a fall, they might get a brain bleed that is so severe it might be fatal. But what is most scary after the fall is just, I don't want to fall again, because I know what happens after a fall. I might have a hip fracture, I must have a bleed in my brain. So I developed this fear of falling. So I remembered because I'm a Hokkien, so I remember my great aunt always say to me, besai patu, si liao lo. That means cannot fall, cannot fall. If I fall, I will die. And often we call it a prophecy. So they are predicting what happens after a fall. So after they fall, they just don't move. They do not want to go out. They stay at home. And then because they don't move, then their muscles get weaker. And before long, they become wheelchair bound. And it becomes, we call it a downward spiral of deterioration. So a study we've conducted at the emergency department from 2006 to 2016, so a 10-year study found that in 10 years, about 80% of people who first presented to the emergency department with a fall are still alive, but 20% of them have already died within 1 year. So even cancer statistics nowadays are not as scary as this. So falls can be deadly. So now that we know that falls are not such good things to have, what can we do? Well, thank goodness that we actually have methods of preventing falls and also getting you back on your feet and helping you stay on your feet after a fall. Okay, so this is the My Fate study. So this study was conducted between 2013 and 2016 at the University of Malaya. We recruited people 65 years and over who've had 2 falls in the last 12 months or 1 fall with injury. And what we got them to do was to actually do exercises. So these are the Otago exercises, to strengthen your muscles. We went to their homes to actually look at the safety of their homes. And we also asked them to do eye tests. And if they have problems with indicating that they need glasses, or if they have cataracts, then they can have their cataracts sorted as soon as possible. And for certain people, we also who need it, we also looked at the medications and try and manage their medications. We also looked at their blood pressure to see whether they have low blood pressure. And we actually give them advice on water drinking and referred them to have the treatment for bladder problems if they need to. So we call this individualized therapy. So we have 6 components, and not everybody gets all 6 components. But what it is we do the assessment and prescribe the components that they need. Okay, so following the My Fate study, we then conducted a study called the Life After Fall study, or the LIFE study. And this looked at physical activity in people who are falling, as well as heart rate and blood pressure changes in those who are falls, and also the home environment in people who have fallen. Because what we feel is that the biggest problem with people who have fallen is psychologically they are fearful, and therefore they avoid activity, and they're more likely to fall as a result, because the loss of activity will actually increase the risk of muscle weakness and the reduced social contact. So if you reduce social contact, then you're more likely to become depressed. So indeed, our study had found that fallers are people who have fallen, move less. They're more likely to suffer from depression, and depression affects the heart rate and blood pressure controls. And people who fall also tend to have houses that are less conducive. So therefore, we do propose that older people actually increase their physical activity, especially after they've fallen, not reduce physical activity. They should have the home environment looked at, and they also should actually make sure that they have their heart rate and their blood pressure checked again. Okay, so unfortunately, the LIFE study was affected by the COVID-19 pandemic, but with every great challenge gave us new opportunities. So we realized we couldn't reach our research subjects. So therefore, we actually had to pivot our research to conduct it virtually. And this was very important at a time when older people couldn't leave their house because the government said stay at home. So we were still able to reach those who have had a fall by assessing them virtually. And now the assessment that we developed for the virtual research is now available to be delivered as a virtual assessment to the public even after the COVID-19 pandemic. Okay, so as a result of all our research, we've actually delivered packages, developed packages for you at home that is actually available at an acceptable price. Remember, for us to actually deliver the packages, it has to be sustainable. While we all hope that the government will pay for everything, the government has a limited pot of money, and it's very difficult to sustain packages like services like this without individuals willing to fund some of these assessments. So these packages are added extra to whatever the government has to offer. And it will ease the burden on the government health service, and they are inexpensive. And we worked together with the government health services. So we actually offer home hazards assessment, as well as falls risk assessments, looking at various risk factors for falls. So thank you very much for listening. And this is our contact details, as well as our Facebook page if you require more information. Thank you.
Moving on, our next session is exercise to reduce falls risk by Dr. Sumaya Ahmad. So Dr. Sumaya is an academic scientist, and she's attached to the Center for Healthy Aging and Wellness and Physiotherapy program based at University Kebangsaan Malaysia. Dr. Sumaya has a PhD in medicine from University of Malaya, and she also has a master's in applied statistics, also from University of Malaya. Dr. Sumaya has published more than 50 papers since 2014, and her area of expertise includes epidemiology in aging and rehab, falls, and musculoskeletal issues in older people. So without further ado, Dr. Maya, on to you.
Thank you, Kitara. I will share my slides now. Assalamualaikum and very good afternoon, everyone. So I'm Dr. Sumaya. Again, I'm a non-clinical lecturer attached to physiotherapy program in UKM. Okay, so for my topic, I've given this title, Muscle Strength and Balance Activity. Right. So please give me permission to, my slide is half is in Bahasa and half in English. But either way, I just, mix Bahasa and English in my talk. Okay, so what are the important thing about muscle strength is that, just like what Prof. Tan mentioned, is one of the main factor for risk of falling. So especially in the lower limb, where that when our muscle is low in strength, it will actually influence our balance, especially in the joint and the proprioception. Okay. Other than that, we are also concerned about this condition named sarcopenia, in which older people tend to get muscle loss. Okay, if we can compare our body during our age, like 25, and if you are older than when we are getting older, we actually lost some of our muscles. So sarcopenia is related to muscle loss. Okay, so how do we diagnose sarcopenia? It's actually by looking at muscle mass, also the muscle strength and physical performance. So usually in physical muscle strength, we use hand grip strength to test our the hand dynamometer to test our hand grip strength. So if you would like to test about your muscle strength, you can actually go to App for Health. We have all this equipment to test it, and also the physical performance like gait speed, okay, and also time up and go, right? So these are the common, or what we call gold standard in measuring physical performance to actually diagnose sarcopenia. Okay. Again, what are the importance of exercise when relate to reducing your risk of falling or preventing your falls? Is actually when we exercise, our muscle becomes stronger. Okay, it has been proven that exercise can actually reduce the risk of falling about 20%, and if you are doing it like every week, 3 hours per week, it can be reduced by almost 40%. Okay, so what are the type of exercise that can be done by older people? Is a lot. Okay, you can do coordination exercise, tai chi. Okay, if you all in Taman Aman, there is like a group of the people who do tai chi every morning. You can always like join them to do tai chi. And then there is also aerobic exercise. Okay, if you go to any, like in Bangi, we have Taman Cempaka. There is like Zumba class, Zumba group. You call it a Zumba group that we can follow them to do the aerobic. And recently in our Poway UKM, we always do like 1 week twice exercise on chair aerobic. Okay, for those who are unable to stand, you can also do aerobic on the chair. Okay, and also yoga. Okay, if if you think that you are too busy to do all this kind of exercise, there's a lot of what we call option to be active. So I will play a short video to let you know, or to give you some idea on what are the physical activities that can help you to keep you active in at your age. Yeah. I hope. Okay. So what I would like you all to highlight is actually for you guys to know what are the light intensity activities. What we are considered light is like slow walking, doing yoga, doing household chores, or even standing up. Okay, so these are the light intensity activity. Okay, so to be considered moderate is like tai chi, hiking, double tennis, cycling. So how do we consider it as moderate? If we, you can still talk but not sing. So if you are doing this activity and you feel your heart rate and your breath faster, then it's considered a moderate intensity. Okay, and for the vigorous is when, okay, sorry. If you can increase the moderate activity, or even doing it in at the what you call a resistance Okay, such like doing fitness dance, or even martial art, or hiking on hills, or running, aerobic, okay, or playing football. So I think this video is important to give all of us like suggestion or option. What are the activities that we can choose to do to keep ourselves active? Okay, right. Okay, what I'm going to focus on today is actually Otago exercise, with what Prof. Tan's mentioned just now. In our MyFit study, we actually tested this exercise as part of the multifactorial intervention. So this is exercise actually come up by Prof. John Campbell at University of Otago, New Zealand. It has been tested clinically around the world and is known as the best exercise to actually reduce the risk of fall. So, I don't know. It's okay. The exercise is 30 minutes per session, 3 to 5 session per week. Okay. So what are the, benefit or the advantages of Otago as compared to other exercise? It's actually cheap because you don't need any equipment. Okay, you just need the ankle weight or the weight. Okay, and it can be done indoors, not necessarily outdoors. So for those who unable to walk around or going out to any park, you can just do this at your home. Okay, and it's actually easy, and it doesn't really need a team. Sometimes certain exercise need instructor and also friend, right? But this one you can do it alone. So this is the scientific evidence about Otago. Actually, it's not just reducing the false risk. It's also will reduce mortality risk. Okay, so from this study, it has shown that with Otago, it can reduce mortality by actually pulling the data from this 7 study available on to test it on the Otago on the mortality risk. Okay, and in we actually publish it. This is actually my PhD study. We publish it in a journal called PMNR. So what I did is actually to do a secondary analysis to look for those who has osteoarthritis. We know that sometimes those with osteoarthritis has difficulty to move, right? So they are they are afraid to do certain activities which they fear that they will get the pain or deteriorate their osteoarthritis status. But we did this study among those with knee osteoarthritis, okay, and also with impact gait and balance lah. Means they are actually had a poor time up and go. Okay, and then we looked at whether this Otago exercise improve their postural balance and also fear of falling and other false risks. Okay, so this is actually my participants. Okay, I measure the postural balance on this false plate. Okay, and then this uncle is actually standing on a foam, which is quite unstable, but
Sorry, Dr. Maya, you're muted. Can you unmute yourself? I think someone would have accidentally muted you.
sorry. Let me see.
last you mentioned was he was standing on a foam.
Yeah.
Yeah.
So to measure their postural balance, whether they can control in unstable condition, we put our participant on the foam, okay, to stand on the foam, and then this force plate will measure the sway, okay, whether they are swaying to the front or to the back, okay. So the less sway means the better postural control, okay. In addition, we also measure their fear of falling. Fear of falling is measured using this short falls efficacy test. We asking them whether they are concerned, okay, when they are getting dressed or undressed, okay, take a bath, sit and standing from a chair, okay, going up the stairs or going down the stairs, taking something above their head, okay, walking on the slope, or even joining any social activities. So we are measuring their concern on falling when they are doing these activities. Okay. So what we found that this Otago exercise is actually effective in improving their postural control and also reducing their risk of falling. Okay. So my take-home message for Otago is that this Otago exercise is actually proven to reduce the risk of falling and also mortality, and it's actually very easy to do and practice, and doesn't really need a high cost. Okay. But also it is important to take a safety measure. Okay, use appropriate attire and also shoes before doing the exercise. Okay, and do the warm up, of course, prior to the exercise. Okay, when we do warm up, it will improve our blood circulation to the muscle. Okay, and also be aware to the environment. Okay, look out for all any obstacles that can be a false hazard during the exercise. Okay, or if you have any eye problem, make sure everything is within your control. Okay, and then drink sufficiently. Okay, drink a lot of water will help you or prevent you from the dizziness or even low blood pressure. Okay, and you can actually stop if you think it's too much, and if you feel like your sakit dada and any part of the body. Okay, all right, and don't hold on the object that can be moved, okay, mobile object or not stable, because after this I will show you what are the exercise involved in this Otago exercise, which is very important for you guys to take note on really hold on static object, not moving object like a chair, very unstable. Okay, and then doing it slowly. Okay, and then if you feel dizzy or chest pain or even sesak nafas, you should get help. Okay, so this the exercise. So while you are listening to me, you can actually test. Okay, just follow the test, the activities. So first, usually we start with the head movement. Okay, head movement, and then neck movement. Okay, and back extension. Okay, there are actually about 30 exercise in this Otago. For those who are institutionalized older people, usually the physiotherapy who work in the hospital will prescribe. Okay. But for our previous study, the MyFit study, actually our physiotherapists also prescribe the intensity to our participants so that they will keep progressing. Okay. Right. By extension, trunk movement. Okay. And then ankle movement. So these are the video in which the lady are doing the ankle movement. Okay. And then front knee strengthening. For front knee strengthening, usually we will strap on the ankle weight so that it will give pressure to the leg. Okay. And then back knee strengthening. This is where our the importance of holding to a static object. Don't use a chair or any like table with the wheel or any other things that can be moved. Make sure you have a very firm or very stable furniture to hold on. Okay. And then this is the side hip strengthening. Okay, which can help with the hip, to strengthen the hip. Okay. And then this one is calf raises. Okay, so you can see how to do a calf raise, but by holding to the support. And then this one with no support. So usually our physiotherapists, they will first prescribe the participant with whole support. If the participant is, they can doing this easily, then they will increase the difficulties by prescribing with the no support and all. Okay. So this one is toe raises. Okay, with whole support. So the participant needs to repeat this movement by 20 times. Okay. Then this one with no support. Knee bends. Okay. Looks easy, right? So I think any of us can do it. Right. So this one knee bend without support. Okay. And then backwards walking. If whole support, you should have like rail here to support you. Okay. Right. This one also backward walking without support. Actually, this one should be this lady holding on the rail. Okay. Just like in the gym, right? They all have like bar, so they can hold on the bar. Okay. This one is walking and turning around. Okay. With a figure of 8. This is very good for the balancing. Okay. And then this one is sideways walking. Okay. Right. And then heel toe standing. So we need to hold on this position for about like 10 seconds, like that. Okay. And then heel toe standing, no support. Heel toe walking. Okay. Right. Without support. And then this one is one leg stand. Okay. Hold support and also without support. This is actually quite challenging even for me because if we hold like more than 10 seconds, we lost our balance, right? But if we are doing it correctly, we will improve our balance. Okay. Then this one is the same thing lah. Okay. And then heel walking with and without support. Okay. And then toe walking, menjinjit lah orang Melayu. Toe walking with and without support. Okay. And then heel toe walking backward. Sit to stand, 2 hands. and then one hand. So this one is actually options. So the physiotherapist will prescribe you with the most difficult one according to your condition. Okay, this one no hand. And then lastly is the stairs walking. Okay. So that's all about Otago exercise. So, but don't worry if you can't really, remember every movement. Actually, App for Health have already provide, prepare a package for Otago exercise. So you can always go to our center to sign up for this program lah, Otago exercise. So I think that's all from me, Kitara.
Now we move on to our third and final session for today before the Q&A session, which is preventive screening among older adults by Dr. Rose Haslina Rosli. So Dr. Rose Haslina Rosli is the CEO of Act for Health Services and Consultancy. She's basically the brain behind all this that's happening right now. She has a PhD in medicine, converted, meaning she did her bachelor's degree and then converted straight to a PhD from University of Malaya. She's also currently a research associate for Dementia Care and Prevention Project Collaboration. Formerly, Dr. Nina was a postdoctoral research fellow in UM, and her entire research pathway has been focused on dementia. And her research was, at that point of time, was supported by the NIHR Global Health Group on Dementia Care and Prevention. Dr. Nina has presented both locally and internationally as part of the Aging and Age-Associated Disorder Research Group and the Dementia Care and Prevention Project Collaboration. So without further ado, Dr. Nina, we are excited for your session. On to you.
Thank you so much, Kitara, for your kind introduction. Welcome and a very good afternoon to everyone. So I know that all of you are staying until now, to the late afternoon. I really appreciate to have all of you here. So for today, I would like to share about this preventive screening among older adults, because this is, to me, kind of some sort of way wrapping up what Prof. Tan and also Dr. Maya are sharing just now. So, but first of all, I would like all of us in the same understanding or in the same context of what is preventive screening. Okay, so in a simple term, preventive screening means that you are getting a regular checkups and tests even when you are feeling fine. Okay, because the goal here is to catch the potential health issues early before they cause symptoms or become more serious. All right. So by staying proactive with this health checkup, you will increase your health or your loved one, the chances of preventing or catching the problem early when they are still easier to manage or treat. So it's like giving your body a regular health checkup means to catch anything unusual before it becomes a bigger concern. So to introduce the next forward slide, I would like us to have a look at this video, because I want you to understand as well why I want to advocate about this preventive screening.
When it comes to aging, we can learn a lot from nature. Consider a tree. As it grows, its rings expand outwards, telling the years gone by. But those rings tell more than just time. If you look between the lines, you will also see how the tree's habitat and living conditions have impacted its life. The healthier the ecosystem, the more it will have thrived. We humans are no different. As we age, our physical and social environment provide us with vital resources, access to healthcare and proper nutrition, opportunities in education and employment. Safe housing and supportive communities become the roots that nourish our development and well-being. So what happens when we grow older if our environment does not sustain us? Just like a tree, our health declines and we struggle to flourish. Over time, we may become disconnected and a burden to others. The UN Decade of Healthy Aging aims to give everyone the opportunity to add life to years, wherever they may live. A transformative collaboration of diverse sectors and organizations, the decade focuses on changing how we think, feel, and act towards aging, cultivating age-friendly environments, creating responsive healthcare systems and services, and promoting long-term care and support essential to living with meaning and dignity. By adding quality to quantity, we give all people the chance to lead a meaningful life, no matter their age. And that includes you, and you, and you, and me. Together, we can make every year count, not by the numbers, but how we live and grow in between.
All right. So I hope that some of you have some context on this. Okay, so this UN 2021-2023 UN Decade for Healthy Aging, it is actually like a special 10 years period from this years, where countries all over the world are working together to make sure that all the adults can live healthy and happy life. So during this year, they want to figure out ways to make this healthcare, communities, and everything around us to prepare and become better for all the adults. So it's like a big effort to help everyone age in a good and healthy way. Okay, so here there is a 4 main decades action areas, where age-friendly environment, combating ageism, long-term care, and integrated care. For the purpose of this talk on preventive screening, I would like to focus more on integrated care. Why? Because for this integrated care, WHO also have addressed a diverse health and well-being that needs of that older adults needs. So this WHO integrated care for older people, or we call it as ICOPE, is introduced in 2020. Yeah, so here is mentioning that integrated care is highlighting on the importance of for us to focus on the key domains of intrinsic factor or capacity. Like here is listed on the key of locomotor capacity, the vitality, the visual capacity, psychological capacity, cognitive, and also hearing capacity. To make you understand more, the importance of this is will bring opportunity to us, the public health, and also as a community as a whole, for us to start action across the life course. So if you see here, the ICOPE approach is started from when someone in the declining capacity towards someone who already have significant loss of the capacity. So we are here at For Health. We want to advocate about the preventive screening because we are part of the health services that we want to support our government in doing this and give all the benefits to our community. So in the health services aspect, we want to focus on while we are still able to prevent chronic condition or to ensure early detection and control it. Even if when someone already started to show the symptom, but still hopefully we will able to do something on reverse it or to slow decline in what capacity that we have. Like what Professor Tan and Dr. Sumaya shared just now, we have tons of studies have been conducted and we found a way for us or intervention or something that we can do to improve is there any problem regards to the senior health. Okay. So again, so preventive health is the screening for health problems that are not yet causing a symptom. So usually people will screen for a disease like blood pressure or high blood pressure, high blood sugar, and also cancer. But sometimes people also forgot to look at this area, which is the one that we are talking in the earlier session about falls, and also how all this cause depression among older adults. And also important thing we mentioned about preventive screening is the vaccination or the medication to reduce all this future illness. So I would like to have some interactive session because I know it's a late afternoon, just to make sure that all of you are still here with me. Okay, so I would like you to put in a chat box here. I have my phone so that I can read the question, the answer. How many of you or your loved one have had a health screening recently? And can you share with me what health screening that you guys it is? Okay, I give you a few minutes to type in. Hopefully to see there's some response. Zania Ahmad, okay. That's a good start. Come on, come on. Mammogram, okay, this is good. Nur Aniza. I went for some form of neuro assessment, electrolyte testing, blood screening, coloscopy, full wellness examination, hearing. Oh my God, so all of you are a very good audience. Blood test for cholesterol, diabetes, general health screening. Okay, blood test for cholesterol. LOLs. Okay, hearing analysis. Okay, I'm happy that you guys all are in the same understanding today. Okay, health screening at UKM, UMBI under Malaysian cohort. Oh, so this is a research participant, is it? Okay, so thank you so much. I don't know if my son into the screen or not, but he's just next to me. Apologize for that. Okay. So thank you so much for sharing. So I saw there's some of the cancer prevention screening that have some of you taking up, and the others general as well. Okay, so with that, I would like to share about some cancer screening. Yeah. So this is an article or chapter that published in 2022, where the author are actually discussing about when we want to decide whether someone to have any type of preventive screening, we need to actually look at a few factors whether to decide they are take these things or not. Okay. So these things you can see is a scale here, where in my left side is increased likelihood of net benefit, and then in my left side is increased likelihood of net harm. Okay, because for this paper or this article is saying that to deciding whether older adults should be screened for cancer is challenging. Okay. Challenging to make the decision because it's best to consider factors like how long someone is expected to live and a likely of outcome of the screening. Is because the cancer screening, while it can increase the level of survival, but it is important to balance that against potential harm like any discomfort or any risk, or how is the impact on the overall well-being after they taking that screening. Okay, because when deciding if either older adults should get a cancer screening, doctors need to estimate how long they might live, means the life expectancy. Because this is matter because screening may not be helpful or may even cause harm if someone won't live long enough to experience the symptoms. Yep, because they have a shorter life expectancy. So as people get older, the cancer rates might increase, but the overall life expectancy might go down. So this making the screening decision is complex. So doctor will use various factors. Need to note that this is beyond age, yeah? It's not just about age, but it's also important to predict whether the person's health status, together with how long they might live. So condition like heart failure or severe dementia or cognitive problem may suggest that they will have a shorter life expectancy, while those who are having a good health and those who are still able to perform daily task activity will might indicate a longer life or longer life expectancy. And then also next is that you need to decide that the potential benefit of the cancer screening, because even if the screening test is likely to work in older adults, it may not help those with a shorter lifespan, because like I mentioned earlier, some of the benefits may take time to show up, or the treatment might show up. Okay, to conclude all this, we need to understand that in deciding to have cancer screening or to decide whether or not to get any type of screening, we need to consider some of the factors include, which is about the life expectancy and health condition, not just age. Okay. So you see how the complexity, if we're talking about in the context of cancer screening. So for today, so what should we screen for then? All right. So again, I flash back this slide, which is the WHO ICOPE. Remember that this have all these key domains of intrinsic capacity. So this actually is a worldwide effort, so it needs to be taken into account in whenever they're providing all the services for older adults. So let's look at what other countries are doing. Okay, for Singapore, our neighbor, the closest to us. So they are having this program, call it as a Project Silver Screen. Yeah, it is part of the Singapore 2023 Action Plan, where it is initiated by the Ministry of Health and Temasek Foundation Care. This solely to focus on to bring functional screening to more seniors in the community as part of the ongoing efforts in preventive health to help seniors to age well in place. So this functional screening, as you see, is simple and pain-free checkup for Singaporeans who are aged 60 years and above to help detect age-related decline in terms of focusing on vision, their hearing, and also oral health early as possible. Okay, so they're using this motto, I feel young Singapore. So live well, age well. All right, so that's for Singapore. And then the other country that have a good portfolio in terms of bringing health services is Australia, where there are free government health screening programs available to older adults of Australians, which is 60 years and above, where they have mentioning about every year's screen that they need to do, or what are the screening that they need to do at least 2 years once, every 3 years, or every 5 years. So all of this, we have seen that this country actually taking very serious to look at to this. Okay. And the next one is the United States Preventive Service Task Force in the US. So in the US, this initiative works to improve the health of people nationwide by making evidence-based recommendation of effective way to prevent diseases and also prolong life. So they focus only on preventive service, which is offered in a primary care setting, or services that are referable by the primary care clinicians. And this is actually applied to patients without sign or symptoms of the condition or the problem. So that's why the name is preventive service. So we can see that the main area that they're looking at is the mental health, substance use, cognitive health, safety and function, elder mistreatment, physical health, and cancer as well. So how about Malaysia? Okay, so for Malaysia, there is a program that introduced by KKM, our Ministry of Health, under the Family Health Development. So this health screening is for senior citizens who are 60 years and above. So this is one of the services that you can get from a health clinic or clinic kesihatan. Okay, so I don't know if any of you just first time to hear it, but this is what is our government are providing. Okay, so we want to introduce this health screening status form where we want to identify health risk factor with intervention and referral carry out necessary. So that is what the government initiative. I don't have slide for that, but this is the what basically our government are providing for our senior people. So Today, I'm putting into perspective of what is our effort in Act for Health, that we want to bring all this evidence base that we have done from our own local data, our own populations. Like one of it in this paper is Dr. Sumaya's paper also about the Otago exercise. That's about the time up and go in detecting the balancing and the mobility and also the memory test. That is actually my PhD paper there. And also where our tools that we have validated in Malaysia have been used by the National Health and Mobility Survey 2018 that looking at elderly health. So by putting all this evidence base together from our Age and Aging Associated Disorder Research Group from University of Malaya, so we are introducing this as a one package where we call it as a senior health booklet. All right, so for this senior health booklet is a package of the evidence base just now that I share with you, some of the paper that I'm flashing to you in the earlier slide. We call it as a preventive screening. So we try to cover the key domains of the intrinsic capacity of the older person, like what WHO or ICOP have been suggested for us to focus on. So this includes the vitality, visual, hearing, cognitive, locomotor, and psychological capacity. So as this is how our senior health booklets looks like, and we are happy to say that we are covering about 10 areas, which includes screening memory, falls, social care and support, continence problem, or a caregiver support, mobility, dental, hearing, vision, and depression. So if you see here also, we are not just focusing on the person itself who maybe who might have the problem, but we're also looking at the in a bigger way where taking into account how is the support or the caregiver playing role into this as well. So who needs senior health booklet? So it's the same advocacy that we want to bring here is those who are 60 years and above, who are still actually say, I'm feeling fine, I have no problem. Like you see in the cover page of this senior health booklet is someone can still cycling, yeah, waving happily face, or for someone who feel that they are started to have something. So it means that they're curious to know about how's their health and all. So for this booklet, how we package is that we will follow up you or your loved one for about up to 5 years for the booklet, where we suggested, research suggested for every 6 months or at least once a year to be done this screening. I think it's as default by the others health screening as well, like at least once a year need to be done. Okay, so I guess this is my last slide. So I would like to thank you, but before I leave this screen, in my closing, I would like to embrace the power of preventive screening for our seniors or our older adults, because just as we cherish the wisdom and experience that you or your loved one bring to our life, but let's ensure that you or your loved one, their well-being will be staying proactive about health. Yep. So by prioritizing preventive screening, you actually pave the way for a healthier and happier future. So please remember, a little prevention today can lead to a lifetime of a well-lived tomorrow. So thank you for joining us, and thank you for joining for my session. And this is crucial journey towards a better senior health. Okay, so with that, I pass to our beautiful MC, Hitara.
Thank you, Dr. Nina. A very insightful session once more. It really tied basically what we're trying to achieve today, which is to encourage healthy aging and to encourage preventive screening. And yeah, okay. So now we move on to the Q&A session. So I think there were some questions on the chat box, which I would like to tackle first so that we don't miss out on that. And then we'll open the floor to questions from members of the audience. So hold on, sorry, I'm just sharing my screen right now. What is happening here? Sorry. Yeah, okay. Okay. So okay, there's some questions for Dr. Maya. So I think we have Yagya Prasad who's asked if his question being, does it mean that for all the exercises do we need ankle weight?
All right. Thank you, Kitara. Okay. Mr. Yagya, actually, for the ankle weight is purposely for the certain movement in the Otago exercise regime lah. So just like the one leg stand, we will strap on the ankle weight so that it will give some pressure to the leg. Okay, so it's not for the all movement, it's for the certain movement. So of course, if you would like to join the Otago exercise program, you will need to bring your own ankle weight lah. It costs only like 40 ringgit for the pairs of ankle weight. You can just buy in. I think last time I buy in Tesco. Yeah. Yeah. I hope that answer.
Okay, another one for you, Dr. Maya. What is your opinion of minimalist shoes for walking exercises? Or should seniors wear usual athlete padded shoes?
Yeah, okay. Just now I actually Googled what is the minimalist shoes. Is it like just the slippers or like very minimal? But I found that it's not really what we call like sport shoes. It's very simple shoes, and I actually read a article from the Harvard Medical School. They actually suggest that expert recommend replacing walking shoes at least every 400 kilometer you walk. So the main thing is actually to get a very comfortable pair of shoes. um, okay, I think which is with padded shoes is better. You will be feel more comfy, and it will motivate you to walk more farther, and then it will keep you do the activities lah. Yeah.
Okay, Dr. Maya, why is walking backwards exercises important?
All right. Regarding the walking backward, actually is studies show that it's effective in stimulating the muscles in the knee joint and also quadricep, so that the energy consumption will be increased and it will strengthen your knee joint and of course your lower limb muscle as well lah. So instead of just walking forward, you can also do backward walking to improve your lower limb muscle strength. Yeah.
Okay, so we have some questions on the senior health booklet. Okay, for this one, basically, you can walk in and ask at our center in PJ section 19 Act for Health Services and Consultancy. Senior health booklet is physically not available in other states, but we have virtual options as well. So by that considered, I mean, it is available lah, no matter which state you're in, virtual assessments at least. For private practice access and purchase of the senior booklet, I would suggest that maybe you can get in touch with Dr. Nina and she'll be able to advise further. Is there, okay, so there's more questions coming in. Okay, but before we move, before we tackle the ones on the chat box, is there anyone here who would like to actually just ask questions? So you may raise your hand and I'll call out your name. Or if you're shy, then let's just stick with the chat box then. Okay, we have Serene. Serene, you want to unmute yourself and ask your question?
Yes, hi. I just wonder if earlier there was some give some contact even after Prof Tan and the others. How do we contact them if we have some more question for them or we want to know more?
Feel free to reach out through the Act for Health Facebook page, Instagram page. We'll also give you our contact information at the end of this session, so you can reach out through that as well.
Okay, thank you.
Okay, no problem. So we've got two hands that's been up since the start of this session, actually. So that's Christine Teo and Janet Tay. Is that by accident, or do you have any pressing questions that you've had to ask from the start? Okay, I'm assuming that's by accident. Okay, we have Sue In Lim who's raised her hand.
Um,
Yes.
Thank you for organizing this session. I have three friends who couldn't make it for to tune in today, and they have requested me to check with you all how can they get a recording or view a recording of what they miss.
The recording will be sent to you. More information on that will actually be provided to you much later through email. Probably once you filled up the feedback form.
Okay, thank you very much. Because this it's very useful, and it's good to share to those that are keen to know. Thank you.
Thank you. We're glad you think so too. Okay. Okay, let's go back to the chat box. So we have some questions on by Ann Jo Koo. Is there any way to test seniors' muscle strength? Is there anyone who would like to take that? Prof. Tan, Dr. Maya, Dr. Nina?
Hi, yes, I can do that. Yeah. Okay. So actually there are loads of ways to test muscle strength. So the easiest way to test it in your own home is to actually see if you want to test your leg strength, is to see how many times you can stand up and sit down in 15 seconds. Okay. So if you're struggling to do that, to stand up and sit down repeatedly, then maybe you have got muscle weaknesses. Or if you don't really want to test, you feel you're afraid of, if you feel you're a bit afraid of falling, then what you could do is also ask yourself, am I able to still do things like carry shopping? Am I still able to run up a flight of stairs like I used to be able to? If the answer is no, I used to be able to do that, but I've stopped being able to do that, then this is not old age, it's abnormal. And I know it sounds strange because society expects older people to become weaker as they get older, but it is not normal to become weaker. Yeah, so simple things like that you should still be able to do. And it's a good test of muscle strength. But what we're actually asking people to now do is to actually go and get it done formally. So you have a grip strength dynamometer that we can actually get you to squeeze. We get a measurement, and that measurement needs to be measured every 6 months to see whether it has reduced over time. So that's more objective, and so we are likely to pick things up earlier. I hope that answers your question.
Thank you, Prof. Tan. Perhaps you can also take the next one, which is how to treat osteoporosis.
That's a really big question. Okay, I can't tell you how to treat osteoporosis, the full story, because osteoporosis is actually a very specialist area. And if you have got confirmed osteoporosis, it's not something that you should try and treat yourself. You should see a specialist. So what we are asking people to do is to prevent osteoporosis. And that can be done by, and I'm sure you won't like me, because you need to do exercise. So exercise is weight-bearing exercise. So we must have gravity. So cycling, swimming is not weight-bearing exercises. So there needs to be a little bit more than just walking. So you do need, we're talking about a little bit of things that makes your body take more of your body weight. So if you're going to walk, then you need to do a bit more brisk walking, climbing stairs, and exercises such as jumping rope. So a little bit of jumping, not a lot, just a little bit. Jumping jacks all help you build your muscle and build your bones. But if you feel that you're a bit worried that your bones are already thin, then and you're over the age of 60, it's probably a good idea that you actually get a screening test for osteoporosis before you go ahead and do all these jumping exercises. If you already have osteoporosis, it might cause more damage. And the screening test is not too expensive. Sometimes you can go to a pharmacist, they can screen for osteoporosis, but a lot of private health facilities now offer osteoporosis scans. And if you screen positive for osteoporosis, you should see a specialist for treatment. So other things you can do to strengthen your bone is to make sure you eat enough, you consume enough calcium and vitamin D, as well as you have enough exposure to sunlight. So we all know that milk contains calcium. So we need to make sure we drink milk every day, but better than milk, probably yogurt and other calcium-containing foods. If you don't drink milk, it's going to be very tough because you're not going to get enough calcium. But other calcium containing foods can help too, and you might have to take calcium supplementation if you can't drink milk. But you also need exposure to sunlight. They say that at least 20 minutes of exposure, probably not midday sun, 10 o'clock in the morning or early afternoon, would help. But not too much, because if you get sunburned, then you increase your risk of skin cancer. But by and large, most Malaysians don't get enough sunlight exposure because we stay out of the sun. Yeah.
Okay, thank you, Prof. We have more questions. Is there any population-based preventive screening programs by our public health care or government?
Yeah, thank you for the question. So I think this is referring to this our KKM initiative, where that you can access to Klinik Kesihatan. So I saw in the chat box that thank you so much for our very active audience, that they're saying that some of them have went to this program, and they have shared also about where once you go there and then they will have a follow-up appointment for. So it's something that you can have a look. How about this? So because after this, we will contact you through email to ask you to provide some feedback. So we will try our best to provide you with any link or resources for you to access to this kind of program. Okay.
Thank you, Dr. Nina. Okay, our next question by Maurizio. Any suggested exercise to reduce joint pain, specifically knee joint pain? Dr. Maya, you want to take this?
Yeah, all right. Okay, regarding the exercise for knee pain, actually Otago exercise is a very impactful to reduce the pain. From a previous study, there's a lot of studies that have reported that it improves the knee pain. And of course, any aerobic exercise is also benefited to beneficial for improvement of the pain severity, and also most importantly is the function. Okay, so keep yourself active and don't avoid exercise. Okay, it's actually help you to the repairing physiological changes in the knee. So it's actually help with strengthening the muscles, and eventually it will reduce the pain. Yeah.
Thank you, Dr. Maya. We have a question by Coach Peter Lam. Is there any screening for movement disorders like Parkinson's? Anyone would like to take that?
Yeah, I think it's really difficult to know where we stop with screening. So one of the things that we need to discuss when it comes to think about when we do screening is how much it costs, how worthwhile it is. Because every time you screen something, it costs money. You need a lot of labor to screen a whole population, and also if you want to do screening. Every time you screen for something, you create anxiety. So and it might lead to tests that cost more money. And inconvenience. So the inconvenience, the mental stress, and also the cost of the screening needs to be worthwhile in order for any government to implement the screening. And the threshold will change with depending on where you live. So with regards to movement disorders, currently, I don't know of any particular health service that will screen for movement disorders, mainly because I think there is really little advantage in picking it up early, because there's no cure and it's an additional burden on the person to know they've got a disease that is not curable. So it's not a cost issue, it's the stress issue and unnecessary anxiety issue. But we do say to people that, we do try and educate the public about what symptoms of movement disorder is. So the most common movement disorder would be Parkinson's disease. And unfortunately, a lot of people already know about Parkinson's disease. So you tend to have the shakes, you walk a bit slowly, and you are at risk of falling over. So if anyone feels afraid that you might have Parkinson's disease, then most doctors have been trained to diagnose Parkinson's disease. So please go and see your local GP and ask them, I've got the shakes, do you think it's Parkinson's disease? So they can simply do a simple examination, and based on what they found, they might decide that, oh yes, you might have Parkinson's disease, and they will then refer you to a specialist, usually a neurologist. And in some places, you get the luxury of Parkinson's disease specialists, specialist neurologists. And so basically, it's more of creating public awareness. If they feel they might have a movement disorder, then they can go and see the doctor, and the doctor can then refer on if necessary.
Thank you, Prof. Tan. Okay, our next question. Is there any geriatric support group around in TJ? I think we have a lot, but Dr. Nina, you want to take this?
Yeah, thank you. We do have compiled the directory for this. So like I mentioned just now, we are happy to provide these resources to you in the email.
So it is a huge advantage that when you join our programs, our webinars and things like that, you also get access to resources, which would otherwise be you would have to painstakingly Google and do your own research and things like that. So please do continue joining our programs, because there's a lot more of information that you'll be able to obtain through your participation. Okay, next we have a question on how to prevent or reduce rheumatism. Prof. Tan, you want to take this?
Okay, by rheumatism, you mean arthritis. So there are two common types of rheumatism, because there's less common problems as well. So one is osteoarthritis, which is by far the most common cause of rheumatism. And then there is the rheumatoid arthritis, which is a very severe form of arthritis that can be very disabling. So fortunately, by far the most common cause of arthritis is osteoarthritis, which is actually Maya's main area of research. Yeah, and to be honest, a lot more can be done about research on osteoarthritis. So we're very, very grateful that Maya's taken this on, because previously, before we started considering it as a potentially preventable non-communicable disease, we usually just say, oh, wear and tear arthritis. So the story is very long, but actually the simple story is maintain your weight. So make sure you don't gain weight, because increased weight will lead to an increased risk of osteoarthritis. So make sure you are able to control your weight all your life. And if you have problems controlling your weight, get some help. Yeah. We do know that weight gain and obesity is actually a medical problem. Yeah, it shouldn't have the stigma it does. If you feel you have trouble controlling your weight, getting help is very important. Number two, exercise regularly. I know you're like, exercise, but that wear and tear cause arthritis. No, we don't believe that anymore. If you exercise properly and you don't repeatedly use the same movement all the time to wear out one joint, regular healthy exercises will actually prevent osteoarthritis. And in fact, even if you have arthritis, we actually still promote exercise to prevent osteoarthritis. So the other group of osteoarthritis people actually get traumatic osteoarthritis. Now, those a lot of times is occupational. So we do work with nowadays our SOCSO and occupational health doctors are very interested in working with with fraternities, employers, to make sure that people don't get osteoarthritis due to their jobs. So overuse osteoarthritis or traumatic osteoarthritis.
Okay, thank you, Prof. We have another question. How much sleep is adequate for senior citizens?
I think that's definitely a question for me. I spend my
Yes.
life talking to patients about sleep. And my answer is always, if I cracked the problem, I would be a very rich woman, because nobody has solved the problem with sleep in old age. So, and we do know that as you get older, your quality of sleep gets lower. But sleep is very important, and people who feel sleep deprived can become very unhappy. So, but one thing we know, people who stay very active during the day tend to sleep better. So guess what? The answer is exercise to improve your sleep. And the amount of sleep everybody needs is different. Everybody is individual. If you were Margaret Thatcher, you will only need 4 hours sleep a day. But then most people, as common garden people, will usually need by the time you're over 60, you need about 7 hours of sleep. But when you're a baby, you need about 12 hours of sleep or more. So we do know that the quality of sleep goes down and amount of sleep goes down as you get older. The right amount is different for everyone, and you can enhance your sleep by staying active during the day. But the rest of it, will make me a very rich woman once I've cracked it.
Thank you, Prof. Okay, so I wish we had more time for questions. We've got lots and lots of really interesting questions that we got from the registration form, but rest assured you will receive your response within the next 1 week. Thank you for being so engaging, actually. So, but before we conclude the session for today, and also thank you to all the speakers for very graciously attending to all the questions that were asked during the session. Okay, so a little bit more on what are the services that are provided here. Oh, no. Sorry, my screen is not moving. Okay, wait, let me just unshare it and share again. Okay, so good news. Act for Health is offering 10% off their senior health booklet program that was mentioned earlier. So if you're interested, all you have to do is just contact Act for Health from 29th of February, meaning today. So if you're interested, immediately start contacting them right up till the 14th of March for a special offer to book the senior health booklet appointment slot. So the slot will be available from 6th of March to 30th of April. And there are an array of tests that's being offered. We have BMI false risk. So just now we were talking about false risk. That's also included in the senior health booklet service. We have hearing tests, memory tests, emotional tests, social care and support, caregiver support, continence, vision, and oral health tests. So you do not want to miss this offer. So for those who are asking, how do we contact Act for Health? So this is a QR code to our website, our Linktree website. So all you have to do is just get your phones out right now and scan the QR code. Otherwise, no worries. This will also be sent through email. So you do not have to rush and get your phone out right now to scan it. You can also wait for our email and then you can contact us then as well. More information on the senior health e-booklet can also be obtained through the QR code, which will be sent to you via email as well. So upcoming event, we have a webinar on the 6th of March 2024 from 3 to 5 p.m. So this one is on lighting the path to cognitive health near infrared technology for seniors. This will be delivered by Mr. Wilson Tok, who's a psychologist from Delta Mediscience. And although the target is, the target population is public and healthcare providers. So for all of y'all who are interested, please just feel free to join. Registration is free. You get an e-cert and you also get CPD points for healthcare providers. Okay, so
Thanks, everyone. Please do come and join all our other talks.
Thank
Yeah,
you.
sure.
We
Thank you
will.
so
Each other
much.
friends.
Thank you.
Thank you.
Bye-bye.
Bye.
Thank
Bye.
you.
Thank you very much.
Bye.
Thank you very much for coming and spending your evenings with us. Thank you.
Thank you very
Thank
much.
you.
Bye-bye.
Thank you. Bye.
Bye bye. Bye bye.